baby get skin to skin with you on your chest when you are on all fours birthing your baby?
Hi, I'm Angie. I've been a midwife for the last 13 years and hit the follow button for more pregnancy, birth and parenting information. If you yourself had a baby in all fours position, let me know in the comments below what your experience was. I myself had my second baby in all fours.
Demonstrate this twice. Firstly with the pelvis. So the pelvis you can see, the back is uppermost. So this is representing a mum on all fours just like this. Baby's head will crane. If you are having a hands-on birth to be able to put a nice warm compress to reduce the chance of tearing, then your midwife will place a hand on the perineum here and encourage you to breathe slowly baby's head. Baby's head will come out, they will then restitute, they will turn, so the shoulders will come out, and what will happen is baby will come out with the placenta still attached here with the cord, and baby will then be passed through your legs and skin to skin with you while still attached to the cord to enable that delay cord clamping. Baby's head will pop out. Then what will happen is you wait for another contraction, baby's shoulders will turn, baby will then come out, your midwife will be able to look and just check if the cord needs a rejig at all. If it's around the neck or anything, we do a bit of a somersault action and a somersault movement to release the cord from baby's neck, because it's at this point that becomes an issue. When baby is born, we need to make sure that baby can take that first breath in. And then what will happen is baby's now born and will come through your legs, and more often than not, mums will reach down and bring their baby skin to skin with them on their chest. How far up your baby comes onto your chest for that skin to skin depends on the length of the cord. If you've got a particularly long cord, baby can come right up to your chest, maybe even want to start breastfeeding in those first sort of 15, 20, 30 minutes potentially. If you've got a particularly short cord, it might be that your baby is just on your tummy, skin to skin with you here and dried here. Now at this point, as a midwife, this is where we just watch and wait for a moment. At some point, the mum will normally turn around to you and say, can I get a bit more comfortable? And they will usually, with some support, go onto their bottom somewhere along the lines where they are supported, where they are comfortable. Usually some pillows are placed so that you can be skin to skin whilst you are led back at that stage. And that can enable and facilitate the delay cord clamping for as long as possible until either you birth the placenta on your own with a physiological third stage, alternatively you have the injection for your placenta where your midwife will help guide out the placenta with your consent, doing something called controlled cord traction. All fours birth help to take the pressure and the weight off of the perineum. What this does is helps to lower the chance of tearing, but also keeps your pelvis really open, opening up your coccyx, meaning that things like shoulder dystocia are slightly less likely as well, because the pelvis can open far more freely, and also help with the pushing stage because gravity is your friend in this case.